Hello everyone, I'm Dr. Deepa. Today we will learn about the elbow joint of the upper limb. We study the elbow joint under the following headings, that is the type of the joint, the articular surfaces, ligaments, relations, the arterial and the nerve supply of the joint, and the movements of the joint. So to begin with the type of the joint, the elbow joint is typically the hinge variety of the synovial joint, as it permits movement only in flexion and extension. When we look for this picture carefully, we can appreciate that the joint is contributed by the three bones, that is the humerus from above and the ulna and the radius, which are the forearm bones from the lower end. Now these three bones together make up the elbow joint. Before elbow joint, the joint is the compound joint and it consists of two components. Here, as we can see, there is a joint between the humerus and the radius which makes up the humeroredial joint along the lateral side, and along the medial side there is a joint formed between the lower end of the humerus and the upper end of the ulna, making up the humeroulnar joint. So thus this is said to be a compound variety of joint as well. Now when we look for the articular surfaces of the joint over here, the articular surfaces taking part in the humerus are the trochlea on the medial end and the capitulum along the lateral aspect. Whereas in the lower part, the articular surface is mainly contributed by the head of the radius over the lateral side, and medially the joint is completed by the trochlear notch of the ulna. So this is about the bones taking part in formation of the joint. So this is the anterior view of the joint in the full extended position. This is the posterior view of the joint where we can make out the olecranon process of the ulna fitting into the olecranon fossa of the lower end of the humerus over here. This is a picture showing briefly the parts of the lower end of the humerus and the corresponding part of the radius and ulna. As we can see, the posterior view of the humerus lower end visualizing the olecranon fossa and the two epicondyle. Yes, the two epicondyles, that is the medial and lateral epicondyle, does not take part in formation of the elbow joint. On the other hand, when we look for the posterior view of the radius and ulna over here, we can make out the head and neck of the radius and the olecranon process of the ulna along with the part of the supinator crust and the posterior border as well. Now this is the picture when the joint is seen in the fully extended position of the arm. We can make out the olecranon process of the ulna fitting into the olecranon process which is present along the posterior part of the humerus. In this picture, we can make out the articulation between the capitulum and the head of the radius along the lateral side of the joint over here. Now this is the diagrammatic view showing the joint. As I have already told you, the articular surfaces of the joint is formed by the trochlea of the humerus and the trochlear notch of the ulna along the medial border, and along the lateral side the joint is completed by the capitulum of the humerus above and the head of the radius below. This is the radiological view showing the normal elbow joint where we can make out the capitulum, the trochlea here, the head of the radius, the dark shaded part representing the olecranon process of the ulna. Now this is again the atlas view showing the articular surfaces of the joint. As we can see, the capitulum articulating with the head of the radius, along the medial side the trochlea articulating with the trochlear notch of the ulna. Along the posterior view we can make out the olecranon of the ulna fitting into the olecranon fossa of the humerus above, and the head of the radius articulating with the capitulum along the lateral side. So this is all about the type and the articular surfaces of the joint. Moving on to the ligaments of the joints, there are in total 3 ligaments of the joint, that is the capsular ligament, the ulnar collateral or also called as the medial collateral ligament, and the radial or the lateral collateral ligament of the elbow joint. Moving to the very first, that is the capsular ligament. The capsular ligament of the elbow joint, which is also called as the fibrous capsule, represents the capsule which covers or encloses the entire joint cavity. This fibrous capsule is thin in front and behind to permit easy flexion and extension, whereas laterally the capsule is thickened to make up the collateral ligament. On the lateral side, the capsule is thickened to make up the collateral ligaments on the either side. So this is about the fibrous capsule. When we look at the attachments of this fibrous capsule, anteriorly the fibrous capsule is attached above along the upper limit of the coronoid fossa as well as the radial fossa, excluding the epicondyles. So the capsule excludes the epicondyles and includes the radial and the coronoid fossa anteriorly along its proximal side, whereas posteriorly the attachment of the capsule is along the upper limit of the olecranon fossa but at the level lower than that of the anterior side. So this is about the proximal attachment of the fibrous capsule. So proximally, the fibrous capsule is attached to the lower end of the humerus along the upper limit of the coronoid and the radial fossa, excluding the epicondyles on either side and along the upper limit of the olecranon fossa, falling a bit short in this position. In the lower part, as we can make out over here, the lower part of the fibrous capsule gains its attachment over the margins of the trochlear notch, as we can notice here, and as it goes laterally, it merges with the ligament, that is the annular ligament. So this is about the attachment of the fibrous capsule. The synovial membrane is seen to line the inner surface of the capsule as well as the bones which make up the joint over here. So this is the picture showing the articular capsule and also the synovial membrane lining the joint cavity. Next, moving on to the ligaments, that is the ligaments on the either side, which is the medial and the lateral collateral ligaments. This picture represents the medial collateral ligament, which is also called as the ulnar collateral ligament, This ulnar collateral ligament is triangular in shape. Yes, the ligament is triangular in shape with apex directed upwards and the base directed below, directed distally. So above the ulnar collateral ligament or the medial collateral ligament is seen to get attached to the medial epicondyle, the area just beneath the medial epicondyle. The area just beneath the medial epicondyle gives attachment to the ulnar collateral ligament. It has got the anterior band, the posterior band and the inferior band. When we talk about the anterior band of the ulnar collateral ligament, it gains its attachment over the medial margin of the coronoid process. The posterior band receives its attachment over the medial margin of the olecranon process as seen here, whereas the inferior band is seen to connect the two bands, that is anterior and the posterior. So this is about the ulnar collateral ligament, ulnar or the medial collateral ligament. I repeat, the medial collateral ligament is triangular with apex directed above, where it receives its attachment to the area just beneath the medial epicondyle. Below, it represents the anterior band, posterior and the inferior. The anterior is getting attached to the medial margin of the coronal process. The posterior receives its attachment over the medial margin of the olecranon, and the inferior band connects the two, that is the anterior and the posterior band. Other than that, there are some structures which are related to this medial collateral ligament, that is the important nerve. Yes, the ulnar nerve is seen to be the important relation to this ligament, that is the ulnar collateral ligament. Other than the ulnar nerve, we can also see certain muscles like that of the triceps, the brachialis and the biceps muscle, which are related to the ulnar collateral ligament. So the triceps muscle, the attachment of the flexor digitorum superficialis, the attachment of the flexor carpi ulnaris. So all these muscles are also related to the ligament, medial ligament, that is the medial collateral ligament. So that's all about the medial collateral ligament. Moving on to the next ligament, that is the lateral collateral ligament, which is also called as the radial collateral ligament. This radial collateral ligament receives its attachment proximally from the lateral epicondyle of the humerus, directed down, receives its attachment over the head of the radius, and it is seen to merge with the annular ligament. It is seen merging with the annular ligament along its distal portion. So this is about the lateral, or also called as the radial collateral ligament. So the medial and lateral collateral ligaments are triangular in shape and represents the triangular expansion. So this lateral collateral ligament is related to the muscles like supinator. It is related to the extensor muscles like supinator and extensor carpi radialis brevis. Extensor carpi radialis brevis. So these muscles, the two muscles of the extensor compartment, is related to the lateral collateral ligament of the elbow joint. So this is about the ligaments of the elbow joint, which are three in number: the fibrous capsule, the medial and the lateral collateral ligament. This is the atlas picture showing the ligaments, that is the joint capsule over here, the radial collateral ligament on the lateral side, and the ulnar collateral ligament over the medial side. We can make out the triangular expansion of the ligament, that is the radial, as well as the ulnar collateral ligament from its medial and the lateral view. This is the same picture, that is the atlas picture, mainly showing the ligament, which is the part, that is the collateral ligaments, which are actually the part of the articular capsule itself. So this is again the medial and the lateral view representing the radial collateral ligament here, and the lateral collateral, sorry, the ulnar collateral ligament from its medial end. Next, moving on to the relations of the elbow joint. The relations are the anterior relations, posterior, the medial and the lateral relations. To begin with, the relations in front of the elbow joint, or the anterior relations. The immediate anterior relation is the muscle, that is the brachialis. So the brachialis make up the immediate anterior relation of the joint, followed up by the other relations, that is the median nerve, the brachial artery, the tendon of biceps, and also the musculocutaneous nerve. So these make up the anterior relations of the joint. So posteriorly, the joint is mainly related to the posterior muscle of the arm, that is the tendon of the bicep, as well as the anconeus muscle. Laterally, the relation is mainly the common extensor origin, that is the attachment of all the superficial extensor muscles from the lateral epicondyle, the extensor carpi radialis brevis, and the nerve, that is the radial nerve. So they make up the lateral relations, whereas medially the relation is what about by the nerve, that is the ulnar nerve, the flexor carpi ulnaris muscle, and the common flexor origin. So this is about the medial and the lateral relations. The medial and the lateral relations mainly is contributed by the common extensor origin along the lateral side and the common flexor origin over the medial side. Anteriorly, the immediate relation is contributed by this brachialis muscle. Posteriorly, it is by the triceps along with the anconeus muscle. So that's all about the relations of the joint. When we need to know about the arterial and the nerve supply of the joint, the arterial supply is mainly by the numerous periarticular branches which are derived from the anastomosis around the elbow joint, whereas the nerve supply is mainly contributed by the three nerves, that is the musculocutaneous nerves, the musculocutaneous nerve of the arm, the radial nerve, and the ulnar nerve, the radial nerve and the ulnar nerve. So these are the three nerves which supply the joint. The musculocutaneous nerve mainly supplies the anterior part of the fibrous capsule. The ulnar nerve mainly supplies the ulnar collateral ligament or the medial collateral ligament. The rest portion of the joint is supplied by the radial nerve. It is supplied by the radial nerve. So these are the three nerves which supply the elbow joint over here. Lastly, moving on to the movements of the joint, as I have discussed initially, the elbow joint is the hinge variety of synovial joint as it permits movement only in two directions, that is the flexion and the extension. Yes, the elbow joint mainly makes up only two movements, that is the flexion and the extension. At the level of the elbow, the flexion of the joint is mainly brought about by the three muscles. The primary muscle, which is responsible for the flexion of the elbow, is the brachialis muscle. So the brachialis acts as the chief flexor of the elbow. It acts as the chief flexor of the elbow. Other muscles are the biceps muscle, as well as the brachioradialis, biceps and the brachioradialis. So these are the muscles which make up the flexion action of the joint. So the main flexion is mainly brought about by the brachialis muscle, as I have told you. The biceps muscle acts best when the forearm is supinated, hence it is called as the sprout muscle. Yes, the bicep is called as the sprout muscle of the elbow joint, as it acts best when the forearm is in the supinated position. The other muscle, that is the brachioradialis, is called as the shunt muscle. Yes, the brachioradialis is called as the shunt muscle, as this muscle acts best when the elbow is in the mid-prone position. So the brachioradialis acts best in the mid-prone position of the forearm. So hence called as the shunt muscle. So these are the muscles which make up the flexion of the joint. The second action is the extension of the elbow joint. The extension of the elbow joint is mainly brought about again by the extensor muscle, that is the triceps and the anconeus. The triceps and the anconeus. So these are the two muscles which make up or responsible for the extension of the elbow. So this is about the movements of the joint and the muscles causing the movements. There is something called as the carrying angle in relation to the elbow joint. Yes, the carrying angle. What is this carrying angle? So whenever we see a person handling a heavy weight or carrying the heavy weight, the forearm and the arm doesn't align in the same line. As we can see, there is an angulation formed between the arm and the forearm at the level of the elbow. So this is what is called as the carrying angle. So when the elbow is fully extended, so this carrying angle is appreciated when the elbow is fully extended and the forearm is supinated. The arm and the forearm forms the obtuse angle during this position. So when the arm and the forearm makes up the obtuse angle facing lateral side, this is called as the carrying angle. It is called as the carrying angle. This carrying angle measures about 160 to 160 degrees. So the carrying angle is about 160 degrees, which is directed laterally along the long axis of the forearm. So this lateral deviation of the extended supinated forearm makes up the carrying angle over here. The carrying angle is appreciated only when the elbow is fully extended and the forearm is in the supinated position. So it disappears when the elbow is flexed and when the forearm is in the pronated position. The angulation, that is the carrying angle, is said to be mainly produced due to the three anatomical causes. That is, when the medial edge of the trochlea projects below the lateral edge. So this is the first reason. The angulation is caused partly by the medial edge of the trochlea, which projects below the lateral edge. And the second reason is that the obliquity of the superior articular surface of the coronoid process. So these are the two factors which is responsible for the formation of the carrying angle. The two factors are, I repeat, the medial edge of the trochlea, which projects below the lateral edge of the trochlea, and the second main factor is the obliquity of the superior articular surface of the coronoid process. So these are the factors, the anatomical factors, which are responsible for the forming the carrying angle. So it is the formation of the carrying angle which helps in easy lifting of the heavy weight, and this formation of the carrying angle avoids the forearm from touching the lateral side of the thigh, helps easy lifting of the weight. So this is about the carrying angle. So this is all about the anatomy of the elbow joint, where we have discussed about the articular surfaces, the type of the joint, the ligaments of the joint, which are actually three in number, the relations all around the joint, and the movements, the muscles causing movements of the joint, and of course a note on the carrying angle. So this is about the elbow joint. In the today's video, we will learn more about the clinical aspects or the clinical correlation of the joint in our further video. Thank you.